According to Uganda Demographic Health Survey of 2016, Toro had 4.3%, Ankole stood at 2.3%, Karamoja at 1.9% in terms of fistula infections countrywide. According to the District Health Officer Dr. Anthony Okeng, the number of people suffering from fistula could be higher since most people do not go for treatment in health facilities.
Unfortunately, most of these people are out there in the community, and we are not sure of the exact magnitude of this problem. But now with Terwode in place, I think we are going to intensify our search for these cases of obstetric fistula.
This poses a challenge.
First of all, the community tend to reject them, and they don't want to come out. They, because of the perspective, because of the way the community looks at them, they tend to keep away, and it becomes very difficult for us to identify them.
Because I was sick all that time when I have not got treatment. But now I've already treated, I can now do that work, any business.
Terwode Women's Hospital in Soroti handles fistula cases from all over the country. According to the hospital officials, they have treated over 300 women and young girls suffering from obstetric fistula in the last 2 years.
We also have other regions coming in, especially Bukedi. We have Central Uganda, people are coming. Northern Lango, they are coming, but not many ladies are coming from Karamoja sub-region. And yet, going by the Uganda Demographic Health Survey, survey of 2016, Karamoja is one of those sub-regions with the highest symptoms of fistula-related conditions that have been reported. And so, based on this experience, we think that there are more women still out there.
Alice Masu, Executive Director of Terwode Women's Hospital, says the hospital can't treat all the women in the country and they are faced with challenges.
And the cost-effective manner in which we can implement them so that we can increase access to fistula care for women and girl children that are affected by fistula in the Karamoja sub-region.
There's a fistula in Karamoja sub-region, but still when we look at the numbers of patients who are treating from the region, they are not tallying up. This means that there are patients within Karamoja who are not accessing the service. We have a backlog of fistula patients within the Karamoja sub-region.
She says there are many cases coming from Karamoja that have been treated, but many people have no access to health facilities, and they have engaged the district health officials from Karamoja sub-region such that they can increase the sensitization and see how they can treat the increasing cases.
The environment alone is enough.